Candidate 45678. Good afternoon. Did you read the question?
Yes, I've read and understood the question.
All right. Tell me, how would you assess this patient?
So this is a young Aboriginal woman who's pregnant, who on her ECG shows that she has some, what I think is probably some mild ST elevation in V1 and V2 and some depression perhaps in V5 and V6 with T-wave inversion in 1 and V5 and V6. She's slightly hypotensive and she's slightly hypoxic on room air. So my pre-anaesthetic assessment of this patient is to assess both the mother and the fetus. Mm-hmm. In terms of assessing the mother, I'd like to take a history of the cough, whether it's productive of sputum, whether she has any fever associated with, because I'm suspecting a lower respiratory tract infection. Also like to know whether she's a smoker. I'd also like to know what her normal blood pressure is, because on voltage grounds she has quite she probably has LVH on voltage grounds.
She's currently a smoker and also an IB drug abuser. She referred that also she has some issues with or some problems with because the main concern for her is she's Jehovah's Witness, so she don't want to receive any blood during all the pregnancy or even for the baby.
Okay.
How would you address this problem?
So she's a Jehovah's Witness.
Mm-hmm.
She was a Jehovah's Witness and she's an IV drug user.
IV drug user.
And she's youngish. So in terms of consent, she's also at the borderline of whether she's Gillick competent or not. So I need to assess her in terms of her competence in terms of giving consent. There are privacy issues regarding her age. Has she been she probably fell pregnant when she was 15. I don't know how old the father is. So there's probably some issues surrounding that, given she comes from an Aboriginal community, mm-hmm. And given the prevalence of sexual abuse and sexual assault in the Aboriginal community, this may also be an issue.
Right. She wants to keep this secret, all this information is secret. He wants to be involved, all the family involved in all these problems. So how would you address these problems?
And I'm assuming that she's Gillick competent. So
yeah.
Okay. So if that's the case, I would have to respect her autonomy. However, I would seek advice from more senior colleagues. In particular, I would speak to the senior in charge on for that day to seek their opinion. I would also go to the legal department within my hospital to find out what if there's any legal precedent and what the legal stance is in this state, because it's far North Australia. I actually work in Victoria, so the legislation will vary from state to state and will be different.
She insists that she really don't want to receive any blood transfusion, even for the baby. How will you manage all these problems?
Now, blood transfusion for the baby may not be her decision to make. In that setting, we'd have to, again, speak to legal, but my understanding is that for minors who are not able to give any sort of Gillick competence, it would have to go before the guardianship board, at least in Victoria. I'm not sure what the equivalent would be in far North Australia.
Right. Are you happy to proceed with this case because she's been booked for the next week? Are you happy to proceed with this case?
What do you mean by proceed? Proceed with a normal vaginal delivery?
With a normal vaginal delivery and potential